Good morning. I'm charged with starting the session with placing caffeine intake in perspective and in keeping the program going on time. So hopefully I can meet that. I think exposure assessment's particularly important here and particularly complex because we have a lot of different sources of caffeine, and it's really our tool for changing people's risks and or benefits of caffeine. And in doing that, we've selected two speakers to hopefully give us a way to look at how we look at exposure to caffeine, not the final answer. But what we recognize is we're likely to get different answers if we use different data, different methods, and that's a good thing because it allows us to better understanding not only what intakes might be, but what behaviors might be. If one source disappears, do people go to something else? I'm one of those people who meets the convenience store every morning, and I'm always struck by the same people I see at the same time every day and their selection of where they're getting their caffeine, not only immediately, but for the day as they pack up what they're taking. And I see the same changes that the commissioner just talked about with new sources coming online and being picked up somewhat on availability and preference. So with that, I'd like to ask our first speaker, Diane Mitchell. She's a senior research scientist and the director of the Diet Assessment Center in the Department of Nutritional Sciences at the Pennsylvania State University. She's done a great deal of work in quantifying exposure and intake of caffeine. So I would like her to start with that, stick to our schedule. We're going to use the word exposure and intake interchangeably here, so there's nothing to be construed by that difference. Diane?